Hello, welcome to the Manual Handling Collective. I'm your host, Simone Hepburn. I'm a physio and manual handling educator, and I'm passionate about injury prevention. This is a podcast where I speak frankly with the brain's trust of manual handling and other amazing industry leaders in and around the occupational health and wellness community. You get to meet them, you get to be inspired, you get to learn from their stories, and you get to stay up to date with the latest and greatest in manual handling and wellness. So let's crack on. All right, we might move on from the obesity epidemic to the coronavirus epidemic. And I've got Tracy Nowicki here with me. We are going to talk now about the coronavirus generally in hospitals. Tracy is the clinical nurse consultant for essential equipment store in a large Brisbane hospital, and recent events with the coronavirus has led her department to be responsible for the PPE, the personal protective equipment and supplies through her hospital. So I'm sure she's got a lot of interesting insights on the current situation. So Tracy, can you tell us how the supply chains are coping? Is it too early to say, or have you had any early thoughts on the lessons on the supply chain?
Yeah.
Obviously there's been rumours and stories in the media about running out of gowns and masks and things.
Yeah. That's a very general question because I can only talk for where I work, and that does vary even from site to site within our district. What I do want to say, I really want to give our public, our healthcare workers, reassurance that Queensland Health is doing a fantastic job. And there is some really good high-end decision makers. And now that we've moved into this pandemic, there is a lot of strategy going on. There's a lot of mobilisation of teams going on, and so there's a lot of negotiation way above my head that is looking at how they can source suppliers probably outside of what we normally use. So if we just relied on what we normally use, it will get used up. That's unreasonable to think that a normal supply could last. I have been saving up for a long time with our PP&E, so we are very well placed, but none of us know what we're going into here. So I think the biggest thing is preparedness with COVID, and there is some really amazing stuff going on. So that's the message I really want people to understand is we are in a very fortunate position in that we're learning from what happened overseas. And we've got some really good investments happening into our health system to really help us to cope with this big strain that's being placed on our health system.
And in your team or outside of your team, can you talk us through some of the common staff pressures or changes that you've seen, things like changing practices or rosters as we gear up for the next stage of the coronavirus potentially spreading?
Yeah. So one of the things that's happened in our hospital, we've got an amazing CEO who has really engaged all the staff, and she's running forums daily to engage the staff, so that gets rid of rumours. The second thing is she's also engaged all our high-end decision makers, and everybody's on board. So we have 2 meetings a day, and she's quite an incredible leader. So that has really helped to get everybody on the same page to work together. There's a lot more decision making happening that I don't really know because I'm too busy doing my job. We're all sort of placed with what we're doing, but there is, wards being emptied in preparation. So there's sort of all these triggers. So they sort of decide when we get to this point, we'll be already ready for the next point before it happens. That's what I see happening is they're constantly forecasting and constantly being prepared. And I think what this does is it stops. Because they're constantly strategizing and constantly communicating, they're making decisions before we need to, and this stops bad surprises and bad decisions. So everything's kind of ready to go. So, there's wards that have been emptied in preparation. And stuff.
I was going to say, I've spoken to some of my allied health colleagues who worked in outpatient or community settings, and they've been discharging their patients with home programs, and then they've been redeployed into things like public health contact tracing, phoning those with coronavirus and tracing their close contacts.
Yes.
And then also
just to
extra
make sure,
hours overtime, weekends, evening shifts.
Yeah. Yes, there is a lot of redeploying, but I just want to encourage you also to know that a lot of the staff are being upskilled. So there's a lot of training going on as well. So nobody's just being dumped into roles. So, it really is quite, I think we all need to stand proud in Australia of our health system and really know that there is a lot of discussions going. It's not just local belly button looking at, it's a lot of people are talking at high levels, and that's going down into committees that are responsible for different things. So, some might be collecting data, some are working on equipment, some are working on staffing, but there's a lot of pre-planning. It's not waiting until the tsunami hits. It's actually planning towards, and maybe we'll be over-prepared. I don't know. Nobody knows. We don't know how we're going to go.
Well, it's very reassuring to hear. On a personal note, we know that healthcare workers are fairly resilient species generally. And what's the mood or the feel of workers on the front line who are in the acute settings at the moment?
Yeah, it's difficult because, like I said, I'm so busy doing my job, it's really hard to get those one-on-one conversations. I think, understandably, healthcare workers are just we're all part of the public, and the public is very anxious at the moment. In our hospital, we're well prepared, so I think people are feeling pretty good. And we're also, I think it's the future planning and the communication that's working really well. But there are so many positives coming out of this. Like, we are working so well together. I've had some amazing experiences with our executive team, and they're working really, really hard. I think people are getting quite tired, but absolutely in awe of how they are just so committed to getting us through this. I feel very confident in what they're doing, and of course you're going to get people that are nervous about what's happening. That's why we're having to take such stringent control of our PPE. We can't leave it lying out. It all has to be under lock and key. We have to be distributing it on a daily basis and looking at why we're using things. So we are changing practice, but that's responding to the acute situation at the moment. So it's very planned, it's very well organised, and this is so that when this thing really does hit, that we can protect our staff. My impression is that the doctors that are getting really unwell in Italy, it's because they ran out of PPE. So that is our really big thing at a very high level. They're working with different companies to be manufacturing specifically for us, and that's what there's a big team looking at making sure that certain people aren't hoarding stuff and have a whole gold mine while somebody else doesn't have any. They're really trying to be fair and equitable to try and keep all of us safe.
Yeah.
And our executives keep talking about making sure that the staff are staying healthy and well. That's been a really big thing.
Have you got any ideas of what listeners who are at home, who are not on the front line at the moment, anything they can do to help those on the front line?
I think we really need to be positive. I think my biggest successes in life are really bringing in those thoughts of thankfulness, gratitude. In tough times, there are so many things we can be thankful for. We've got a government that is supporting us quite well financially. They're doing the best they can under very difficult and unpredictable circumstances. And I saw one girl outside of health that was feeling very sorry for herself. And I said to her, "You got a job and you're healthy," which is more than half of the people in this world at the moment. So I think it's the little things. Yeah. And there's lots of, some people at work are going around giving little gifts of thankfulness. It's stopping in the corridor and saying, "You know what, you're doing a fantastic job." And what you're doing today, Simone, is absolutely fantastic. When we can't meet face to face, you're actually, giving us this opportunity to share information. And for that, I'm truly thankful and grateful.
Oh, good. I've got my kids at home with me, and I've been making them join me and do a little gratitude journal in the morning. They've got to write down 3 things today they're grateful for, and just trying to keep them in positive spirits at home as well.
Yeah. Yeah.
My last question. What sort of changes, we're seeing so many changes so quickly, what changes in processes or equipment or other things do you think might stick? What's still going to be there on the other side? One shift I've noticed is like you were touching on, that huge outpouring of respect for healthcare workers. It's definitely out there in the community as well. what things do you think might stick on the other side?
We will be a different country when this finishes, and there's a lot of virtual stuff that will change. Our meetings have become virtual. I think hopefully we can come out with a real heart of gratitude and thankfulness, and really I'm mixing with people in my health system that I haven't had to do before, and just becoming each other's cheer squad. You know, this is really where you see people's true colour, whether they can really stand up. And this is what we're trained to do. You know, we're trained to care for people under difficult circumstances, and you're seeing the health system really come together. Look at the private health system and the public health system coming together.
Fantastic.
We've always been one side of the fence to the other. We're seeing our rehab and our geriatric wards being decanted out to some aged care places, and surgery being stopped so we can change everything. I think it's been an incredibly responsive, forward-thinking health system, and I'm sure there will be lots of lessons to learn from this. But I think the virtual thing, I mean, one of the things I've loved seeing is our executive does a virtual forum every day.
Wow.
And every day she talks to her people. And prior to this, we'd have these staff forums, and I'd see all these people in cities at these forums, but very rarely did I ever see a frontline worker. You know, you might get 5 in the whole auditorium. And now I see these frontline workers around the computers all listening to what she's saying. So we're touching more people now with this virtual world that we've created. So I think that's a pretty fantastic thing.
Yeah, maybe another change for training will be more opportunities for online training or online education. We were talking before we started the recording about webinars and things like that. So that might come into the fore more.
Yeah.
Well, on behalf of the Manual Handling Collective and all of my listeners who are at home or not on the front line right now, we are so deeply grateful for your dedication and your efforts and all your team and your hospitals out there in caring for our community. So I wish you and all your team strength, and please keep healthy, and we'll see you face to face on the other side.
Thanks, Simone. It's been an absolute pleasure. Thank you for doing this today.
Thanks, Tracy. You have been listening to the Manual Handling Collective podcast. If you're only listening through audio, we've also filmed this episode. If you want to see a little extra, see the link in the show notes. Subscribe to stay notified of future episodes. Like, share, comment, and get in touch to hear more of what you want. If you know a guest who'd be a great fit for the show, just let me know.